Hello everyone, my name is Gabriele Machado and I'm the president of the First International Integrative Medical Congress. We are so happy to have you here today. Before we get started, I just want to give you a little backstory of how our dream came true. IIMC is an initiative of Uni-FACEF students with the support from Centro Universitário Municipal de Franca, Uni-FACEF, which seeks to strengthen the academic environment and offer a wide succession of lectures and debates that will address the fundamental and most recent themes in the medical practice. We started this dream as we would in 2019, although we were looking in the wrong direction. During the pandemic, all professionals weren't able to talk to their patient, client, or student in person. We spent almost a year and a half inside our home. Furthermore, if we want to help the patient, if we want to give them the right recommendation, we had to be where they were, and we had to connect to them some way, somehow. And that way was social media. We found our speakers on social media. They are health professionals who are willing to share knowledge in an integrative way, either by Instagram, Facebook, or TikTok. The main goal is to guide someone not physically close, however, connect by the same means. That is the goal of our Congress. We are here today to let our speakers guide us with their knowledge. With that being said, we would like to thank every single one of our speakers for this incredible opportunity. It's a pleasure to have you with us. In conclusion, we hope that you enjoy our Congress. Thank you so much.
Our next speaker is Marianela Rodriguez, MD, PhD, bachelor's degree in biochemistry with a minor in Russian from the University of Tulsa, medical degree from Johns Hopkins University School of Medicine, PhD in neuroscience from Johns Hopkins University, internship in internal medicine at the Johns Hopkins University Sinai Hospital of Baltimore, specialization in ophthalmology at Bascom Palmer Eye Institute, clinical fellow at Massachusetts Eye and Ear Infirmary.
Yes. Okay, great. Thank you. Okay, let's get settled. Sorry, I was like running because I was running late.
Oh, that's no problem.
Yeah, so, all right. So should I just start or do you guys have any other questions?
Oh, no. So just before you started, I just want to say thank you so much. It's a pleasure to have you with us. Thank you for being part of our dream that is this Congress coming true. So we are really proud of it. So thank you so much.
Oh, you guys are doing an amazing job. I'm seeing all the posting that you guys are doing online. That's so great.
Yes.
That's great. You guys have great speakers coming up, huh?
Yeah. We got a lot of guys. Like we have 21 lecturers in total, and we have doctors from Taiwan, from US, from everywhere. So we are
really wonderful.
Happy.
Yeah, that's great. Okay, so let me see it. Let me see if I can share this. Just a sec.
So before you share your screen, I just want to say, and you can do like this intro that you can introduce yourself, your specialty, where you're from, and the theme of your lecture. And in the end, if you want, you can just leave a message for the students. And by the end of your lecture here today, Paula will ask you about what is the best day and time. If you can be online with us, like the 15 minutes question answer on the days of the Congress. So we will show like the days and the time that we have available. And if it fits your agenda or everything, it would be really nice to have you this 15 minutes online with us for question answer.
That's great. And are you going to ask any questions today or no? Not really.
No, not today, just on the days of the Congress.
Okay, let me make a note here for myself. Okay. Okay, ready? Sounds good.
So you can share your screen and then you can do like the whole intro.
Okay.
And I'm just gonna say something in Portuguese for the kids here, just so they can like put your picture and your slides. So we'll be here on camera, but like the Congress don't only see you. Gente, lembra de colocar o PIN nela, tá? Para poder aparecer só a imagem dela e dos slides, para poder não aparecer mais ninguém. Okay, that's it. Thank you so much, Doctor.
All right, well, thank you so much for having me. My name is Marianela Rodriguez. I am an ophthalmologist. I also practice retina surgery, and the theme of my talk will be basically about the work life balance as a female ophthalmologist, and some of the pearls that I have learned as I've gone through my training. So when you're deciding on a specialty, there's lots of things to consider. Whether you want to do surgical things or you want to focus more on medical problems, whether you want to practice in a hospital base or whether you want to be in a clinic setting, whether you want to be in a big city or more of a rural area, if you want academics with teaching and research, or whether you want to be in a private practice, honing in your skills to taking care of patients. Do you want to be in a field that is women friendly, that has its own drawbacks and its own positives? And what kind of hours do you want to work? Do you want to work weekends? Does that matter to you or not? Do you want to have a flexible schedule with time off sometimes during the week? Emergency medicine might be a good option. Or do you want to have a very predictable schedule, 8 to 5 every day, weekends off? That's going to make a difference. And then other things to think about are whether there are threats to your specialty, whether there are this is a big problem in the United States that people are considering, whether there are other providers that might be having more of an impact in that particular field. For example, anesthesiology in the United States, there are nurse anesthetists that are, doing a lot of the procedures. And for example, in primary care, there are also physician assistants and nurse practitioners in the United States that might be eating into your specialty. So it's something to consider. I'm not sure if that would be the case in Brazil or not. And then the last thing that is also important is to think about the reimbursement and how you're going to be getting paid. Is it going to be salary or is it going to be performance-based? So that's something to consider because that will put pressure one way or the other when you're making your decisions. So one thing that I would tell medical students as you're going through your training is to keep an open mind. When I think about choosing my specialty, it's kind of like dating. You want to be open-minded, you want to flirt with lots of specialties, and don't get married with the first person you meet. So even if you have your heart set on a particular field, be open to the idea that you might change your mind as you learn more and more. And don't be hard on yourself if you thought you wanted to be a particular type of doctor, just to find out that, the more you familiarize yourself with that field, you change your mind and you want to do something else. So be honest with yourself and don't be afraid to change your course. And then the other thing is that it's important to forge your path. Know early on which residencies will be competitive. And if you're considered one of them, plan strategically, prepare for that, do research, rotations, find mentors in that field. And then if you change your mind later, and you want to do a less competitive residency, your CV will be strong regardless. So you will be prepared for more competitive fields. And what I would say about, choosing the specialty, this is really important to me, is to, consider all the factors that I said when deciding on a specialty, but most importantly, you do have to love what we call in English, the bread and butter, meaning that you have to love the things that come your way, that are going to be coming your way every day. Those cases are going to make the bulk of what you do on a daily basis. Yes, those cool cases, those zebras are very intellectually stimulating, but they're not your routine and you can't hang on to them for the overall job satisfaction. So for example, for me, I would not be a happy physician if I did not like to treat diabetic retinopathy, if I did not like to treat wet macular degeneration, if I did not like to deal with the elderly population. I love those things, so I'm very satisfied with my specialty, but it's because, I do love those diseases that make 80% of what I see every day. So be familiar with the population that you're treating. As I said, 80% of the patients I treat, or even more, are elderly. So I know how to deal with elderly patients. I know what the concerns that they have are. Grief is a big part of it. Depression. I deal with all those things, even though I don't treat them. But I know this population because I treat them day in and day out, and I love the elderly population. So know the population you're going to be treating, if it's women, if it's children, if it's the elderly. Just know that, and know that you're comfortable with that type of population. And really, this principle applies to any area of medicine and of life. You have to really love what you're going to be dealing on a regular basis. So if you're doing family practice and you don't like diabetes and high blood pressure, you might not be wanting to go into that field. So think about that. So I don't know why this thing is not moving. Let's go. Okay. So the other thing that I want to point out is that there are always other options. So, after you finish medical school, most everybody goes into a residency. But just think that if you're not totally satisfied with medicine, there are other options for you. Research, industry, finance, investing, and even medical writing. So I'll tell you the story. My husband and I went to medical school together, and he did plastic surgery for 3 years. And while he was doing it, he decided he did not want to practice medicine anymore. He loved the patients, but he just didn't see himself as a surgeon. And so he's now investing in healthcare, very involved with clinical trials, loves medicine, and loves what he does, and is up to date and all the new things that are coming up into the field of multiple areas. But he doesn't practice as a surgeon anymore. So just want to point out that there are other options for you, even later on in the future, if you're not happy. So the other thing that I'm going to point out is that, at least for me, during training, you're very exposed to academic medicine throughout your undergraduate career, throughout your medical school, through your residency. You're mostly going to be exposed to academic medicine and not so much to the private practice world. And that's because, mostly we do our internship in the hospital. Our professors are people that are invested in research and teaching, and we look up to them, and it's great. But there are other ways to practice medicine, and it's not just one way. So in academic medicine, things to consider is that, yes, the cases that come your way are more complicated. You have more high acuity cases. There are research opportunities, ways to grow that way. If you love teaching, that's something that is available for you. And then there's predictable revenue, and you don't need to focus on the business of medicine. Now, in private practice, on the other hand, you're going to be dealing with more common conditions that make the bulk of what you do every day. Your hours tend to be more flexible because you, at the end of the day, are your own boss. There is no stress to publish unless you do feel that you're passionate about it. And there's no need to climb that academic ladder. And then there is a little bit of more opportunity to make more money in private practice, at least in the United States, but that's not always the case. So why I chose ophthalmology, I'm going to go into that in a little bit, but I do want to introduce you to ophthalmology in a couple of slides. So it is a surgical specialty, and it involves the eye, the ocular adnexa, and the visual pathway. At least in the United States, it is a 4-year total after medical school. There is 1 year of internship. Sometimes those internships are integrated into the program itself, and then 3 years of more training. So it is a competitive residency, at least in the United States. It's one of the fields where a lot of people want to go into. Therefore, if you are considering this specialty, you need to prepare ahead of time in order to be able to match. And that is because it does have great hours. It is clinic-based. The patients are happy. The procedures are satisfying. They're quick. You're usually operating under a microscope, so you have to deal with your hands. And overall, there is low burnout in our specialty. So the one thing is that you do not learn too much about the eye in medical school. So residency in ophthalmology can be a little bit stressful because in medical school, you spend all this time learning about the heart and the lungs and the GI system. But, beyond knowing a few things about the eye, you don't really understand how it works. And so that means that when you start residency, you need to read and read and read a lot in order to catch up regarding the basic science of how the eye works. So that's why it's a little bit hard. The other reason why it's hard is because in ophthalmology, the physical exam, it's critical. Unlike cardiology, I guess you can make the point that yes, cardiology, the physical exam is important, but you can always get an echo, you can always get other testing, an EKG. But in ophthalmology, just looking at the patient's eye will tell you 95% of what you need to know. It's kind of like dermatology. It's very visual. So, and that exam is a little bit hard to do, and it takes a little bit of practice. It's almost like riding a bike. Once you get it, it becomes second nature, but you need to practice to be able to be good at it and examine the different parts of the eye appropriately. So you are expected to report back to your professors what you're seeing, while at the same time you have trouble with the exam. So at the beginning, it can be a little bit frustrating. And the other thing is that at the beginning, as I said, there's long hours. You need a lot to learn. So it can be frustrating and draining, especially that first year of ophthalmology. And there are other specialties that are similar to this. I would say maybe dermatology, ENT, radiology, basically the residents anesthesiology. The residents need to read a lot because there is not too much coverage of these topics in medical school. So just think about that whenever you choose those specialties. So as I said, those 3 years of residency are typically separated differently in different programs, but overall they tend to follow that. The first year, you're going to be, as I said, learning the physical exam, learning how to think about the differential diagnosis for different presentations. You're going to be introduced to basic procedures such as lasers and injections. And then the surgeries in that first year are going to involve things outside of the eye, because the intraocular surgery is much more delicate and the stakes are higher. So, you're going to be doing plastic surgery around the eyelid. You're going to be dealing with the conjunctiva for pterygium, and you're also going to be doing a little bit of trauma. In the second year, you're going to be diving a little bit deeper into the various subspecialties. Most programs introduce you to cataract surgery either at the end of the first year or the beginning of the second year. And everybody that is in ophthalmology loves that rotation, because finally you get to operate inside of the eye and do those very delicate maneuvers. Then you can also do glaucoma surgery, cornea surgery, and then in scrubbing for retina cases, although they won't let you probably do any retina surgery in second year residency. And you're going to continue dealing with trauma. And then the third year, you're going to be doing a lot of cataract surgery. And it's because it's one of those skills, the more you do it, the more you feel comfortable. And it really builds up for other, even if you decide to do other specialties within ophthalmology, being comfortable operating in a very small space with a microscope will really help you whatever else you decide to do in the eye. So even if you decide to then do vitreoretinal fellowship, having done a lot of cataract surgery will also help you become an excellent vitreoretinal surgeon. So what comes after residency in ophthalmology? So some people choose to just go out and do comprehensive ophthalmology practice and practice in basically doing general ophthalmology, taking care of cataracts, taking care of the pterygium that we discussed, taking care of glaucoma. But then if you want to hone in your skills and look a little bit more deep at one of the areas, there's 7 different subspecialties in ophthalmology. 2 of them are 2 years, and those are surgical retina and oculoplastics. Those take, each of them take 2 years. Then you can also do a 1-year medical retina fellowship. Cornea and refractive surgery is also 1 year. Glaucoma is also 1 year. Neuro-ophthalmology is also 1 year, and you can be a neuro-ophthalmologist either by having finished an ophthalmology fellowship or a neurology fellowship. And then a uveitis fellowship usually is also 1 year. And uveitis deals with eye inflammation. And some uveitis specialists also do a surgical retina fellowship if they want to be dealing with the more posterior inflammatory conditions of the eye. And that will also need vitreous biopsy, etc. They might consider doing that. And I didn't put it here, but ocular oncology and pathology are other things that are considered that you can do after residency. So why vitreoretina surgery? So vitreoretina surgeons take care of diseases of the vitreous and the posterior segment. These patients usually have serious eye conditions and sometimes other systemic problems. For example, HIV, diabetes, hypertension, systemic inflammatory conditions, such as lupus, for example, sarcoid, or TB can have eye manifestations. So the surgeries for vitreoretinal surgery are delicate, they're under the microscope, and then patients are always grateful if you can save their vision. So what kind of surgeries do vitreoretinal surgeons do? The bulk of them are vitrectomies. My husband always jokes that I only do 1 surgery, because every time he asks me what cases do you have tomorrow, and I said a vitrectomy. But vitrectomy really is an umbrella term. It's like saying, you know, you're gonna do a laparoscopic surgery. Yes, you're going to go through ports to the abdomen, but you can do all kinds of different surgeries by doing that. And the same thing is with vitrectomy. So for example, if somebody has a retinal detachment, you may do a vitrectomy to repair that retinal detachment. If somebody has an epiretinal membrane, you will do a vitrectomy to peel that membrane. If somebody has a vitreous hemorrhage, you will also do a vitrectomy. If you have to do a vitreous biopsy, you will do a vitrectomy. And then other surgeries that we do for repair of retinal detachment, we can also do scleral buckles. And yes, we can still do cataract surgery, although we usually do more complicated cases or cases in which the lens has been dropped and we have to do secondary lenses. So surgical retina is usually divided into 2 years. The first year is where we focus more on the medical part of retina, taking care of diseases that have to be dealt with in clinic, such as diabetic macular edema, macular degeneration, vein occlusions, artery occlusions, and then all the other degenerative diseases that you can think about, such as the dystrophies, retinitis pigmentosa, etc. And we usually do surgery in that first year only from call cases. And then in the second year, it's where the real training for surgical retina occurs in most programs. Usually, you're going to be doing a lot of the more complicated or delicate cases, such as peels and puckers and holes, that are more the elective procedures. So, as a retina surgeon, the life, I mean, I love everything about it. So as I said, you perform lots of different types of surgery. It's a little bit different from other specialties in that even in private practice, you can be involved with clinical trials and academic endeavors. So as I said, I'm in private practice, but we are a clinical trial site for multiple clinical trials, and we coordinate with different companies to do trials at our clinic. Most of what we do is outpatient. The surgeries are outpatient, and the day-to-day is in clinic. We do tend to have more emergencies than other areas of ophthalmology, because we deal with tears, detachment, endophthalmitis after cataract surgery, or even after injections. But I will say that retina surgeons have a high job satisfaction. And so I will tell you a little bit more about my own career. I was born in Cuba. I moved to the United States for college. I went to the University of Tulsa as an undergrad, and then I went to Johns Hopkins Medical School, where I received a PhD in neuroscience. So because of that, I always thought I wanted to do neurology and neurosurgery, and I'll talk to you about more how I got to my particular field. Then I went into a residency at Bascom Palmer Eye Institute, and then I did my fellowship training for vitreoretinal surgery at Harvard and Mass Pioneer. And now I'm in private practice here in Massachusetts. So as I mentioned, I did do a neuroscience PhD, and I always thought I wanted to do neurology. However, when I went in to do my rotations, and that's what I said initially, to keep an open mind, because you can always change your mind, and you may change your mind. Most likely you will. So when I did my rotation in neurology, I still find it very fascinating, very interesting. However, I just didn't like the day-to-day. I thought it was kind of depressing. The field, even though has a lot of promise for change in the future, I didn't think that was going to make too much of an impact in the day-to-day to my patients. And I thought I might feel burnout with time if I stayed there. And once I got exposed to neurosurgery, I said, no, this is not for me. So I made that decision very quickly. You know, one area that I found particularly interesting, I thought psychiatry was super interesting. But then, and actually considered doing it for a little bit once I was doing the rotation. However, once I was exposed to ophthalmology, I was absolutely in love, and I didn't ever look back. And that was one area that I never really considered when I started medical school in the first and second year. And I only consider once I got exposed to it in the clinic. And, you know, ophthalmology, has a lot of neuroscience, and retina does as well. Obviously, the retina is an extension of the brain. So I feel that, you know, my studies in neuroscience were not done in vain. So how is my practice as a retina surgeon? So as I said, I am in private practice, which I absolutely love. I love the fact that my hours are flexible, that my clinic has a lot of volume, that I get to really know my patients and form this really deep connection with them. The one negative about my situation is that I do have a long commute, and I have to drive a lot. So this part, I don't love this part, but, you know, I have learned to live with that. And And when I'm in the car, I make lots of phone calls and I listen to books and the radio. So that's fine. My days are usually 9 hour long. I'm on call every 4 weeks because I'm in practice with 3 other doctors and we all do retina. So every once a month I'm on call. However, I don't have to go to the hospital when I'm on call. I'm only taking care of the patients in our practice and referrals in the community for acute things like retinal detachments and tears and infections, which have already been seen by another ophthalmologist. So I go to the operating room about once a week. I do about 25 injections a day. I do about 3 to 5 lasers a week. I do other procedures such as pneumatic retinopexy for retinal detachments, about 2 or 3 a month. And then I try to stay really up to date in academics to a certain extent. As I said, we are a clinical trial site. I try to, keep up and write case reports. I participate in podcasts. I'm part of the One Network committee where we review different papers, write for the Retina Atlas, and I try to go to conferences to stay up to date. The one downside is that I do not work with residents or fellows or medical students because I am in private practice and I'm by myself seeing patients. So now I want to switch gears and talk to you a little bit more about my experience as a woman in medicine. This photo we took when it was an all-female OR when I was in residency. So this is me with my baby when I was still a resident. So a lot of students ask me when is the best time to start a family. And my answer would be that there's never an optimal time to get pregnant in medicine. So if you want to have children, the best time is to do it when you choose to do it. So you cannot plan pregnancy 100%. Infertility increases the longer you delay having children. So the one thing that is super important is to have a supportive partner, and you need help if you want to have children, because really a woman that is a physician, you need help in order to make it work. You cannot do it alone. So there are drawbacks in having a child at every step of the way. In medical school, it's probably not too hard because, but if you're in that, stressful rotation, might not be a good time to have a baby, but you can probably switch around your blocks and take maternity leave when you are in a research block or something like that. In residency, it's also hard because you're trying to learn what you're going to be doing for the rest of your life, and you're going to have to do surgery if you choose a surgical specialty. But you can always work with your colleagues, front load yourself while you're pregnant, and then take time off. And then during fellowship is also hard. Again, you're trying to hone in your skills for something that you're going to be doing for the rest of your life. So finding time off is hard. But again, if you are very honest with your co-fellows, if you work with them, you could always find a time to make it work, and with your program director. And then the other thing is that as an early attending in academics or private practice, it's also hard to take time off because you are getting to know your patients, because you're building a practice, because you're having your referrals. Because if you take time off, then your partners or your other doctors are going to be seeing your patients, because you're going to be losing on your surgical skills. So there is never a good time. So don't think about that. If you're going to do it, just do it. It's going to work out and it's going to be great. So having children is really the best decision I've ever made. My first child, I had it as a third-year resident. Here you can see me with my baby. I have my scrubs and I'm reading to her because I just came from call, but I'm so excited to see her. My mom spent 4 months with me. During that time, I was taking call. I was super busy. I went to work 5 weeks after my daughter was born. I cried like I've never cried before because I had to leave her, but then it was great. And, she doesn't remember it, and I'm super happy with her. But I did have a living nanny with me for 2 years after that. And then my second baby, I had right after I finished my fellowship, and then I started my new job for 6 months. You can see this middle picture where I'm like super pregnant. And this is my graduation from my fellowship at Harvard with my two amazing co-fellows, Tony and Kareem. So I worked really, really hard. I was super pregnant. Doing surgery was hard, but it was amazing. And I had two really supportive co-fellows. I also had, as I said, I had a daughter at that time. And so my husband was very supportive. And then I also have a nanny that helped me a lot. And then you can see this last photo where, my son was born, and I'm here with my daughter, and we're super happy. And so my points to you is that, take home points for now. Choosing a specialty in medical school is like dating. So keep an open mind, try lots of different things. But the most important thing to remember is that you have to love the day to day and the specialty you're going to choose, because that's going to make the bulk of your practice, and they cannot tire you out. So don't really think about the zebras that are super interesting, but that you will never see. So prepare for competitive specialties early on. But if you change your mind, that's okay. You will have an advantage nonetheless. There is never an optimal time to have children as a woman in medicine. So if you want to do it, the best time is whenever you hold your baby, regardless of when that falls in your training. And so you just have to enjoy the ride. And so thank you so much. Here's me and my family. I would love to join you and ask you questions and have the Q&A later on. What I would tell the medical students is that, there's lots and lots of things to learn. I'm really, really happy that you invited me to this Congress. And, if you have more questions, I am happy to answer all of them. You can follow me on Facebook or on Instagram or Twitter. I try to post a lot about my life as a woman doctor, and I'm always here to answer those questions. Thank you.
Our next speaker is Ashley O'Heiser. She's a nutritionist and she has a diploma in nutrition and health lifestyle promotion at Humber College in Canada in the Faculty of Health Science and Wellness, internship at Humber Center for Health Living, and now she works at her online private practice, Nuts for Nutrition. She specializes in healing and managing bloating, weight, and digestive issues, as well as a cardiovascular illness like cholesterol and blood pressure.
Okay. Hello, everyone. Thank you so much for coming to my presentation. My name is Ashley, and I am a Canadian nutritionist. I am from a small town outside of Toronto, but I studied at one of the best colleges in Canada called Humber College, Toronto, Canada, where I studied nutrition and healthy lifestyle promotion. In this program, I got to learn clinical, sport, and general nutrition. We also had an internship in the Humber Center of Healthy Living, where we got to work one-on-one with patients, and we also got to do presentations and teach groups of people about different health topics. We also got to learn physiology, which was one of my favorite classes, and a little bit about chronic disease, especially diseases that are linked to nutrition. We got to learn natural health products and even about emerging science. We were actually taught by a naturopathic doctor and a lot of other health professionals like physiologists, dietitians, and people that are working directly in the health and wellness field with patients already. So we got that first-hand experience in our internship and then also working one-on-one with professionals. And we actually got to learn from chefs as well. We had a practical recipe development and cooking classes. We got to learn menu planning as well, which was very applicable for me when working with clients, where I actually am using a lot of this information with my clients and directly applying that, because you can't just send somebody a list of information. You have to help them apply it. And that's why I am so important helping make changes within their lifestyle. So we also learned how to nutritionally assess recipes and meals and how to integrate them based on the situation of the patient. So, you know, you cannot just give somebody a list of information. You have to know how it's going to apply to them specifically. What's their financial situation, their health, their age, their lifestyle, and maybe even their culinary abilities. So I'm able to analyze all of that and then put it into steps and coach clients to get to their goals and to overall create a healthier lifestyle. So a little bit about why I do what I do and my why. It actually started all before, and with my dad. He in his 20s got really, really sick, and he was sick with auto intoxication. If you know anything about auto intoxication, it's basically where your body is poisoning itself. There is a lot of toxic buildup and waste in your colon, and so your body's reabsorbing that, and it can become severely toxic and possibly deadly. So my father was suffering from this, and it just was not working for him. The therapies that he was receiving, it was not making enough of a difference, and he was still feeling really ill. And at the time, you know, this was many, many years ago, medicine was not as advanced as today, because medicine's always advancing. But also complementary medicine was not really accepted. And complementary medicine is where you can consider other therapies, not just not just common medicine, but also alternative therapies, and see if those can work and combine them. So he took it upon himself to research nutrition and other alternative therapies that some people had found successful for them, and some doctors that had found these therapies successful. And after his research, he started applying a healthier lifestyle. And so I was born several years later, and I feel like it was kind of part of my story because I wouldn't have been alive without it. And so I grew up learning all about this. My family lived a very holistic and, nutritionally dense lifestyle. And these were things that my father would share with me just, over the dinner table. And so I felt really blessed for that, but I did actually struggle with emotional eating and weight gain in my teens. And why that happened was I was struggling emotionally to fit in, and I was being bullied at school very severely for many years. And so I had turned to food, and I was relying on food to comfort me. And this is a common thing that happens with many people. So I'm grateful, honestly, that it happened to me today, because I now am able to understand my clients a lot better and know exactly what they're suffering from and how they're feeling, because I went through it too. But the thing is, I was able to bounce back from that. And I didn't actually see any nutritionist because of the knowledge and the habits that I had built before then. And I was able to come back to those and to pick myself up and get better and make healthier choices. And so I realized that others, they were not given the same advantage as I have been given in my life so early on. And so those habits and things might be a lot more difficult or not as natural of a step as it was for me. But I know that they could. And the thing is, I could help them because I can completely understand where they're coming from. And I have the knowledge not only from school, but also from my own life and applying that. So what do I help with? Nutritionists can help with many different things. And nutritionists are a great resource to have in your back pocket as a health provider. Any healthcare provider can reach out to a nutritionist and work with them to give their client better care, because nutrition is one aspect of our health, but it is a pretty big one. It's what are you putting in your body consistently, right? So talking to a nutritionist along with using your therapies is actually a really good option to give better care. And so you can find a nutritionist for many things that you can find a nutritionist that specifies in many different topics. Some of the things that I specify in and I'm really good at are weight management, bloating, and digestive issues. So think like obesity, weight gain, or even weight loss, bloating and constipation, to name a few. And then I do help with some cardiovascular issues, things like high cholesterol or high blood pressure. So how I help. I actually work one-on-one with clients, and that's my main service that I provide. I have a private practice that I run, and clients can come to me and request help. And how I help them is I work closely with them, teaching them how to do it for themselves, empowering them. Because again, like I said, you can't just hand somebody a piece of paper and expect them to implement. It will just sit in their bag forever. Maybe they'll try it 1 or 2 days, but they were never given the skills to actually apply it to their life. And that's so, so important. And I also believe in a holistic approach. So take a step back and remember that, health is not just nutrition. It's not just one aspect. Health has many layers, and there's likely a reason why somebody's having issues with their nutrition. And I'll get into that a little bit more in one of the next slides. So my vision. My vision is actually no calorie counting. And no calorie counting might have you surprised because yes, if you are reducing calories, a lot of times you can reduce weight. But having a client look at calories on a regular basis is actually an unhealthy practice. And it's something that can be dangerous. It can lead to certain restrictive behaviors and possible eating disorders. So I am not a fan of calorie counting. It's not realistic. The other thing that I am a big fan of is balance. And this is something that's really easy to teach because this is what life is about. When you're eating food or you're spending time with friends, whatever it is, it's about balance. You can have too much of a good thing and it will be a bad thing. So I love to equip people with the skills to help themselves. And that's another part of my vision. I will not be there by their side forever. And I'm sure many of you will understand what I'm saying. If you are working in the healthcare industry, we might want to, but we have to give our clients and our patients the skills to fly on their own. And so that's what I'm really passionate about doing. I also love to teach resilience. Resilience is so important because let's be honest, nobody's life is perfect. I'm a nutritionist. I know a lot about health and wellness, but I'm not perfect. We all have times where we slip up, we maybe eat a little bit unhealthy, but the thing that matters the most is, are you able to get back up again? And do you have the habits to become in a place where you were before and get back into your routine and start eating healthy again? You know, I eat a cookie, I eat a slice of pizza once in a while, but are you able to be resilient and come back to having those healthy lifestyle practices consistently? Because that's what's going to make the biggest difference. And looking at the bigger picture, this is what I mean by holistic. You know, there's many aspects to health. So just ensuring that we're looking at the whole picture, even though we have different systems in the body, cardiovascular and, respiratory systems, they are still connected and we have to keep that in mind. And same with nutrition, So the last thing is be realistic. And that's something that's so important because what works for one person might not work for somebody else, or they might not be ready yet. So being realistic with what that person is willing to start doing, what steps they can take, but what's right for their life. A student that lives on campus and doesn't have a kitchen, it might not be realistic to ask them to bake a casserole or, something else. So being realistic about what's going to work for them is so, so important in order to give them care that they can actually apply. So today I've been asked to talk about obesity and we'll get into that. But what is obesity? It basically is when your body has too much fat. You have too much fat in your body, and how we can calculate this. There's many other techniques out there, but a quick way to have an idea is to calculate your BMI. And I did mine right here. I'm blushing, but this is your weight in pounds divided by your height in inches square rooted, multiplied by 703. And that's going to give you your body mass index. Your body mass index is an indicator to give you an idea of what range you're in. Are you normal? Are you overweight? Are you obese, extremely obese, or underweight? But it's not the be all and end all. We still need to use our own minds and maybe some other approaches to confirm that this is correct, because it's only using your height and weight to calculate this. So for example, if you're working with a bodybuilder, they might actually show in the overweight or obese category, but it doesn't mean they are. So you still have to use your own discretion as a healthcare provider to make the call. And you can even use, visually, you can tell if somebody is underweight or overweight using the BMI and using visual characteristics. If you're noticing there's a lot of muscle mass, then maybe it's not as accurate for them. And the other thing I want to note is the older someone is, it's okay to have a little bit of additional fat storage. It's natural. And also women tend to have a little bit more fat than men. So why is it important? Why do we care if someone's obese or not? Like, you know, body positivity. A lot of people are about that. And it is still important to love your body no matter what shape it is. But it's important because it actually can mean an increased risk for disease. And I've listed only a few here. So you can imagine what bad doors that's opening up. And even recently, we've all experienced COVID-19, and we're seeing that that could possibly be an increased risk there. So we have things like increased risk of mortality, sleep apnea, hypertension, mental illnesses, heart disease, and multiple types of cancer. So if you are ever seeing a client in an obese range or even close in overweight, it's really important as their provider to be like, hey, you know, this is something that you need to be cautious about and inform them about what risks they might be more susceptible to. So understanding the patient. This is so important because not every patient is made the same. And we need to understand where they're coming from because it helps us help them better. So there can be many reasons why. Maybe they have a lack of knowledge. Maybe they weren't taught about nutrition at all, or they're just following whatever they see on Instagram or search on Google. So it's so important to recognize that some people are just not given the proper information to make healthy decisions, but they want to. Another reason why someone could be overweight or obese is their mental health. Mental health is a really big topic these days, and it can weigh heavily on the decisions that we make for our lifestyle, our physical activity. So for someone who's depressed, they might stay at home more often, have less physical activity. Maybe they are not eating the best foods and they're just not caring. They're kind of giving up in that process. So that the care for somebody who's suffering with weight issues because of mental health would be a little bit different than somebody who's just not informed. Maybe someone's suffering from trauma. Traumatic events play a big, big role in the decisions that we make for ourselves and how we comfort our body. Going back to my story, I was suffering from a traumatic event, bullying, and the way that I was trying to compensate was eating unhealthy food and overeating. So sometimes people who are having issues with weight have some trauma there. And it's so important to know that. And I'll explain why in the next slide. Another reason why is their environment. Maybe their family, they live together with their family, they all eat junk food. Maybe they're eating fast food and the food in the house is not a good option. And maybe they don't even get to buy groceries. So again, helping that person make a better decision is different than someone who's living on their own. Medication. This is a big one because sometimes medications have side effects and some of them are weight gain. And you would know if you are studying medicine, you would know that, you know, some medications are fantastic and can really help us in many ways, but some of them have side effects and we need to be aware of those. And sometimes we need to ask the patient to work with the doctor that prescribed that and potentially reduce the medication or find one that works better for that person, because weight gain is dangerous, as we've talked about in the previous slide. Sometimes it's about convenience or money. sometimes people don't have the funds to buy healthier food, and convenience. Maybe that person is working a lot and they don't have the time to cook. And so they're just buying microwavable meals, which are high in sodium, high in fats. So these can play into how we would help that person. And then other illnesses. Maybe that person has hypothyroidism, right? Well, if they're not working with a doctor on their thyroid difficulties, and they're just coming to see me as a nutritionist for, their food and what they're eating, I'm only part of it, but they will probably not see results unless they're taking medication or, getting that proper treatment with their thyroid. So understanding the patient, part 2, caution before and during the treatment. A lot of times people who are suffering with obesity have previously experienced trauma or have some kind of mental health, not all the time, but especially with overeating or emotional eating, it can be. And so I may have to refer them to a therapist or, some other kind of professional to give them the best care, because I can only help them nutritionally. So it's sometimes important to keep that in mind, and be aware that that could be something that pops up even in the future or during care. So that person might have a past of restrictive eating and eating disorders. And this might make their weight loss a lot slower because they've kind of harmed their metabolism a bit. And so, losing weight might be more difficult, especially if they're doing things like yo-yo dieting or ketogenic diets for a long period of time without being under a doctor's supervision. It can be dangerous. Being aware of these things is really, really important during and before treatment. So treatment. It's so important to equip and not inform. And that's what I do. I don't believe in giving the client all this information. It's not going to change. It's not going to change them. It's about putting systems in place and helping them practice and be consistent and coaching them through every step until they know how to do it on their own. If again, you can't just give somebody a book and they're going to apply it to their life. It's very unlikely that they'll have the tools to really implement that in a way that works for them. Educate and not overwhelm. For the information that they do need, putting it in simple terms is something so important because people don't know these big words. Some people don't know what hypertension is. So putting it in very simple words for people to understand and meet them where they are at. And only the information that they need to know. They don't need to know everything. They just need to know part of it and what applies to them. So treatment and foods to focus on. My favorite thing to focus on is fiber. Most people are not getting enough fiber. You can see here in the diagram, most people are getting 14 grams a day. This is really poor. Men should have more fiber. Women should have a little bit less, but if it's more or less than the grams that are specified, that's okay. But why is fiber important? It stabilizes blood sugar, so it actually can help prevent diabetes, and it's actually important for people who are diabetic. It detoxifies and removes waste. It helps to remove waste and prevent constipation. So if you don't want a client that is having auto intoxication like my father did, then having lots of fiber on a regular basis, including water. You want to make sure they're having water or they'll get constipated. But that is so important for detoxification and removal of waste. More fiber means burning calories. Your body burns more calories when you have more fiber. So if you're eating something that is a simple carbohydrate, it's going to have very little fiber, and it's going to take less energy for your body to break it down. So actually, fiber is a really good thing. And it helps people to feel full, which is so important. People who are having simple carbohydrates, they're not going to feel full for long periods of time. They're going to get a crash, kind of like if they eat white sugar, their blood sugar is going to spike and then it's going to crash. And it's going to provide most of the time additional nutrients, because areas that we're getting fiber from are vegetables and fruits, and you want to include cooked and raw sources, nuts and seeds, whole grains, legumes, beans, chickpeas, lentils, stuff like that. Super, super important. And one of the reasons why I'm a big fan of whole grains is because of the fiber content, but also because if you're refining grains, so you're taking a wheat grain and you're refining it and making it white flour, right? You're removing all the good stuff. You're removing the fiber and you're removing the wheat germ, which holds all of the nutrients. And then they're sometimes fortifying it, which means they're adding back those nutrients, but they're synthetic. They're not naturally from the food. So this is a problem. They're missing out on real nutrients and natural fiber, and it's a refined food. It's going to spike the blood sugar. So just having more of foods with fiber will help lead them in the right direction. Nutrient-dense foods. And nutrient-dense foods are kind of linked in with our fiber-dense foods because, yeah, sometimes they have both. Fiber is closely linked to nutrient-dense foods, and our whole foods are not fortified, which is really, really important. When we're focusing on whole foods, it's going to give us the nutrient-dense foods that are already what we're searching for. Whole foods can be things like what I mentioned in the previous slide, vegetables and fruits. Include the skins as well, if you can. Maybe not the banana peel or the orange peel, but the other skins like apple skins, cucumber skins. These are things that have a lot of nutrients in them. And when you're removing it, it's not as nutritionally dense. And we want the most nutrients in the least amount of calories. So if you're spending a lot of calories, even though I don't like calorie counting, you want a lot of nutrients per calorie. How to add more nutrients, adding spices and herbs to your food. A lot of people, they're like salt and pepper. There's other spices that are out there that can really add a lot of antioxidants and other nutrients to our foods. And they sometimes don't have very many calories, but they're very, very packed with nutrients. So adding herbs and spices, and also adding herbs and spices helps with reducing salt and sodium and the need for that, because there's more flavor, it's more depth in the food. Herbal teas. Herbal teas are a really great way to add something interesting other than just plain old water. But also there's some nutrients and other benefits from a lot of herbal teas, and many herbal teas are uncaffeinated or decaffeinated, and caffeine-free, naturally caffeine-free teas can be drank at any time of the day, and they add a little bit of flavor in your water or in your hot drink. So it's another way that you can add some nutrients. Again, focusing on whole foods, fruits and vegetables, not packaged foods or anything like that. One thing I wanted to note here is water. Water is so important. It's going to deliver nutrients in your body. It's going to help with detoxifying waste from the body and so many other benefits, but we do need water throughout the day. And that also does include our water intake, includes our like fruits and vegetables, if there's any water content in there. So yeah, the next thing I want to talk about is healthy fats. So people get confused. They're like, I thought fats were bad to eat. No, not all fats. Some fats are really good to eat and we need them for our brain and all that fun stuff. But in moderation, we still are not supposed to eat like a ton of fat. We need also healthy fats. There are unhealthy fats, which I'll talk about in the next slide. But some healthy fats are olive oil, coconut oil, grass-fed butter in moderation, nuts or pure nut butter or seeds and pure seed butters. You have to watch in nut butters and seed butters, there's sometimes added sugar, added hydrogenated oils, which is trans fats. So you need to be careful about that, but you can find a good one and it will be a healthy way to get some fats. Fish like salmon or trout, but you need to be careful not to have too much or you'll get too much mercury or other heavy metals. Eggs and avocado are some other options for healthy fats. So yeah, that's just an idea. So foods to avoid and reduce. I'm not saying that maybe you'll never have this again, but be aware of it. And I'm going to help, I'm helping clients to avoid these things and be more aware of it because a lot of people don't know. They aren't really aware of the foods that have this kind of ingredients like trans fats. So trans fats or hydrogenated oils and also some saturated fats, not all of them. In the slide before, I put coconut oil. Coconut oil is a little bit different than your typical saturated fat. It also increases your HDL levels. So it is somewhat okay. But again, we're not eating like tubs of fat. We're talking about, you know, maybe 3 tablespoons a day. So yeah, we want to just avoid things that have ingredients like hydrogenated oil, trans fats, margarine, deep fried foods or fried foods, cheese, especially processed cheese. There's a difference. There's like that really like, it's hard to explain. It looks like plastic. And then there's like the real cheese that's been aged. There's a difference, okay? Lard, cream, processed meats like cold meats, and high fat meats as well, like lamb has a lot of fat. So you want to kind of focus on more lean options. And why that's important is it's going to increase inflammation, which could actually affect mobility because somebody's going to be in pain. They don't want to move. We're moving and we're feeling good about ourselves when we don't have any pain. So that's really important. But also it's going to reduce our cardiovascular health and it can lead to other illnesses with that. And then we want to reduce sodium, especially from things like fast food, convenience foods, microwavable meals. If we're having too much sodium, it's just generally hard on our body. It's going to cause possibly some issues with your kidneys if you're having really, really high sodium. And a lot of salt that is used is a really refined salt, and it is full of anti-caking agents and other additives. So we don't want that. We want some pure salt. Some other things that we want to avoid: alcohol and drugs, so smoking, but even over-the-counter drugs. If somebody's using Tylenol every day, it's not going to be good for your microbiome. That's why I also love fiber, because it's really going to feed that natural gut bacteria And if you know a lot about gut bacteria, then you know that that gut bacteria is going to help break down food even further and encourage nutrient absorption. And then also alcohol, we want to reduce these things. I'm not saying to never go out for a drink with friends. I don't think that's the problem, but it's the excessive. What are you doing consistently? And so that's what I am teaching my clients. Empty calorie foods. So like refined sugars, white sugar, corn syrup, soda, like pop. If you guys call it pop in Canada, we call it pop. Imitation juices, refined grains. So anything that's going to turn into sugar very quickly. And then we want to try to reduce our meat and animal foods. They don't have fiber content. So if you're having like only animal products, you're missing out on so much fiber that you do need. But in balance, in moderation, meat and animal products is okay. It's just when it's excessive. And if it's excessive, it could be leading to that weight gain issue and maybe even causing things to kind of get stuck and very slow in the digestive system. And maybe toxins are being reabsorbed, like I spoke about earlier. So we want to focus more on lean meats over fatty and highly processed meats. So I'm going to come back to the no calorie counting. I don't believe in calorie counting, not because it doesn't work on like a numbers on a numbers scale, but calorie counting isn't really realistic for the patient. And a lot of the time, sometimes calorie counting isn't the only thing that needs to be done. Like I mentioned, like hypothyroidism and other illnesses that can lead to weight gain. But calories and counting them, I mean, I've never sat down at dinner with my family and been like, how many calories? Let me get my calculator out. It's not realistic. And it's also a really bad habit. It's not sustainable. And like I said, it can be, starting somebody off on the wrong track. By counting all these calories, they might start to become obsessive of them. And they might be like, oh my God, well, I had this many calories and this and this and this. And they're not even able to enjoy eating food and enjoy their life and live like a normal person. And that's the goal about nutrition. It's, not supposed to be mechanical. For many years, humans have eaten together. It's about community sometimes. Eating is about so much more than just numbers and what's going in our body on a numbers scale, but it's about how it tastes and the experience and how your food looks. It's so important to us as a human race, actually. It's tied into, food is tied into our history. So one way that I like to teach clients how to eat a healthy meal and something that is a lot easier for them to follow is something that I kind of created from some other methods that I had seen, and then I added my own twist to it. So Nuts for Nutrition is my private practice. So the Nuts for Nutrition balance plate method is what it's called. And basically it's just this layout of your plate in a way that's really easy for somebody, when they're making their plate for dinner, it's easy for them to kind of go off of. You still have to talk to them about portion sizes in terms of how large is your plate. I mean, if it's this big, maybe you don't want to be filling it entirely, but it gives them a good idea of what to include and the portion sizes. So half of your plate should be fruits and vegetables at every meal. At every meal, you want to include all of these. This is a balanced plate. Then we talk about a quarter of our plate protein and a quarter of our plate starchy vegetables or grains. So this is also really useful for people with diabetes as well, because diabetics should not have more than 15 grams of carbohydrates in a meal. You don't want to exceed that, or it could be spiking the blood sugar too much. But in terms of weight management, this is a really good way to start somebody off. And then also including some healthy fats, because fats will help that person feel full for longer. And also adding in some spices to reduce sodium and some fermented foods to help the gut biome stay replenished. So that's kind of my little method there. And sometimes they're interchangeable, like healthy fats. There's an avocado here, but an avocado is vegetable fruit, but it's also going to contribute to the healthy fats that are in this plate. So sometimes they're overlapping. Like I said, things are holistic, and it's important to keep that in mind. I was trained in not only nutrition, but healthy lifestyle. So I do touch on these topics when working with a client. Everything is connected. Also, I talk to my clients about not hating exercise. Exercise is good, but it doesn't have to be something you hate, like running. It can be yoga, it can be like biking, it can be just being social with your friend and going outside for a walk. So you can find ways to like make it fun, but movement is so important if you're talking with somebody about weight management, because yeah, sedentary life is not going to be contributing to weight loss or burning calories. So that's really important. Baby steps. I work with clients at a pace that is right for them. It shouldn't be overwhelming. It should be one thing at a time. And that's why it's so important to, lean on a nutritionist as a healthcare provider. Maybe you are working with somebody and they need that additional nutrition support. It's great to refer and give that client some extra support so that they can learn to do something on their own and gain the skills while also getting whatever treatment that you are providing them as well. And sleep is so important for that as well. So sometimes I'm discussing sleep habits with my patients, and that is because it's linked to appetite and hormones. If we're really tired, sometimes we want to eat to try to make up for the energy we're missing out on. So the last thing I want to say for this presentation is that complementary medicine is so important, and it's an opportunity for the best care to be given. Complementary medicine is when you're combining alternative medicines, even like nutrition. Nutrition could be considered an alternative therapy, and combining it with conventional medicine, which is probably what a lot of you guys are focusing more on in your studies. Maybe some people are studying nutrition too, but this can give the patient the best care and support. And yeah, so consider referring your patient to give them, more options. But it doesn't mean that you have to give up your patient. It just means that you can work together in conjunction and give that person a better chance for results and a better overall lifestyle. Whether it's obesity, whether it's diabetes, whether it's high blood pressure or cholesterol, you can work together with other providers to give your patient more support. And yeah, I'm sure your patient will thank you, because they will see that you really care about them on a deeper level than just what you specify in terms of what your scope is, but you want to give them care that will, impact them for a lifetime. So we all want to make a difference. And I just want to end that on this note and just say that we all are here because we really want to make a difference for people. That's why most people are in health and wellness jobs, because we really want to see somebody's life made better. It makes us happy. So let's all work together to give the best results for people and a better life that they can really enjoy and be happy. So thank you so much for listening to my presentation and having me at this conference. Yeah, I'm done.
Can you see me? Okay, I think I'm on here.
Hi, Ashley. Can you hear us?
Hi.
Hi.
Yes, I can hear you.
Yeah. Thank you so much to be here with us. It was amazing pleasure. So now we're going to start to the questions, okay?
Yes, go ahead.
Just 1 minute.
Can you see?
You mentioned that you don't count calories, right? I would like to know if you just don't ask the patients to focus on that, or if you also don't do calculations with the calories to boot each patient's menu, like chronic disease, like diabetes patients.
Okay, sorry, I'm having a hard time hearing you. Could you just say that again?
Sure. You mentioned that you don't count calories, right, in your presentations?
Right.
Yeah. I'd like to know if you just don't ask the patient to focus on that, or if you also don't do calculations with the calories to build each patient's menu, like if the patients had a chronic disease like diabetes or something like that.
Right. Calories can still be used by the practitioner. But yes, it's something that I don't like to make a focal point for my interactions with clients, because I find that it's not really applicable. It's not very useful, but it definitely can be used to help give that client perspective and maybe help them that they maybe are eating many calories, for example.
All right.
Perfect.
Can I ask?
Yeah.
The next question is, when the patient returns, do you base his result with the scale, or are there measurements with a edgeometer, for example?
Right. So many of my clients I'm actually seeing online. So they are going to maybe do measurements on their own, or they are welcome to see a doctor for diagnosis, or use a facility that can give them diagnosis, and then they would bring that diagnosis to the nutritionist, where then we can kind of work with them based on what body fat they have, for example, or what kind of struggles they are facing.
All right.
So if working in person with the client, I would mainly use BMI and maybe some physical measurement to track progress.
All right.
Perfect. So the next one is, what's the average number of consults it takes for the patient to be discharged for already having a healthy eating habits?
I think it's very different for each client, and it really depends on where they are at in their journey, what kinds of things they are wanting to change, and also, what change feels comfortable for them. Some people move very slowly when they're trying to make changes in their life, and that feels most comfortable for them. I'm not a fan of pushing my clients too much to the point where they feel it's extremely uncomfortable. So what I may feel is a really reasonable change for them, not be comfortable for them. So for example, if the client was eating ice cream at dinner every night, and they just personally feel like they cannot stop eating ice cream at night every day, I might feel like it's very easy for me to just not have ice cream most days a week and maybe on weekends. But maybe my client doesn't feel that same way. And so we really try our best to not put our own opinions and our own feelings on the client, and therefore the duration that it could take for somebody to comfortably make changes and build habits could be different for one person to the next.
The next question is, I saw that you recommend many types of exercise, such as biking, yoga, dancing. What weekly frequency and minimum time do you recommend?
Right. I think the minimum time of exercise, it's important to get at least 30 minutes of movement a day, whatever that may be, and maybe 3 times a week getting your heart rate up and doing some aerobic activities. But again, every person is different, and it's important to keep that in mind for sure. So it's really about easing the client into what is really comfortable for them, and then moving forward to that goal. So their minimum right now might be really low for some people. But yeah, moving up towards at least 3 times a week, some activity, and maybe doing some walking, and movement, stretching, just getting comfortable moving your body is a really great start too.
Nice. For my last question is, in care for your patients, what is your observation regarding the effectiveness of the nutrition treatment with the patients who regularly undergoes the psychotherapy?
Yeah, I think it is very, very effective. I think that the thing that's really important to remember is that obesity, and like I spoke about in the presentation, obesity and weight is not always a cookie cutter answer. It's not always an easy, like, I'm going to make a math equation and I'm going to get this outcome. Our bodies are not like that. And for example, if it's somebody who has an emotional thing that they need to work through, it might take them some extra time. It might be a little bit more challenging for them. But I find that this process is very effective, and it can help a lot of people to feel like they're making progress and to make some healthy changes in their life that can help them cope and help them move forward. But yeah, effectiveness, I guess it's hard to measure because, again, everybody is a little bit different. But yeah, I think mainly for people who are just overeating and maybe not eating the right foods, and that is the cause of their weight. Yes, I think that it has been very effective, this process.
Nice.
Right. The last question is, how much do you think that a stressful routine interferes in weight loss? What can we do to don't let it interferes?
Right. So stress can affect us in so many ways. Just looking at a holistic approach, stress is not only going to increase our hormone levels, which can cause weight gain, it can also disrupt other daily decisions that we make, and those can be more unhealthy than healthy, for example. So I think that stress is a huge impactor. I think the key is to really lean into some healthy habits when we're feeling stressed and how to cope. And one of those ways could be eating healthy. Eating healthy could be something that really is helping someone feel more comfort and know that they're supporting their body in at least one way. But I think it's also important to move through emotional things, get really, really good sleep. I think 7 to 8 hours a night is something that has been life-changing for me. It's something that I had started to implement in my own life and noticed extreme changes. So I think all of these things and just having some good habits, coping habits, maybe ways to reach out to friends or finding ways to decompress is a really good strategy for reducing stress, which affect our weight.
Nice. Ashley, thank you so much to be here with us. As a nutrition, we know that how this is important to have integrity in non-professionals of health. So it's a pleasure to have you. We hope that you can have you in the next year in your Congress.
Thank you, Ashley.
Thank you.
Bye-bye. See you.
Thank you.
Bye.
The next speaker is Ashley Goyle. He has a bachelor's degree in Science and Biological Sciences from Ohio University, Doctor of Osteopathic Medicine degree from the Ohio University College of Osteopathic Medicine, internship at the Richmond Heights Hospital, residency in anesthesiology from the Cleveland Clinic Division of Anesthesiology, Critical Care Medicine, and Comprehensive Pain Management, fellowship in Comprehensive Interventional Pain Management from the Cleveland Clinic Division of Anesthesiology, Critical Care Medicine, and Comprehensive Pain Management, and clinical skilled in the management of chronic and acute non-malignant pain.
Hi, I'm Dr. Ashu Goyle. I'm a double board certified anesthesiologist and interventional spine and pain management specialist. I'm the founder of Integrated Spine Pain and Wellness in Scottsdale, Arizona. And today I'm going to be sharing my journey into medicine and why I chose anesthesiology and pain medicine as my specialty. My path into medicine was rather unorthodox. In high school, my passion was playing music. I'm a self-taught guitarist, and my best friends in high school are all musicians and also self-taught musicians. And although I excelled in high school at my core curriculum, my passion was playing music and going to live music concerts. So when I got to college, my first year, I was undecided. I hadn't chosen a major. I played music and took classes just to learn about the world, really, and to really deepen my understanding of philosophy and arts. It wasn't until the summer between my first and second years of college that I decided to volunteer at the local hospital just to give back to the community on some level. And when I interviewed for the volunteer position, on my application, I had mentioned that I play guitar. And so the person interviewing me asked me about my guitar playing. And I told him that was my passion and I loved playing music. And he happened to mention that the hospital I was in had a piano player who did inpatient music therapy. And she would play on every Sunday for 4 hours, and patients who were inpatients could gather around and listen to music, or they would have the music played through the loudspeakers throughout the hospital. So apparently she was unable to fulfill her commitment for that summer, and so I was offered the position. So every Sunday I would go to the hospital and play my acoustic guitar and sing songs, and it was truly remarkable how inpatients found that 4 hours. It was a reprieve for them. It was a break from the existence of living in a hospital, overcoming illness, and it was pretty profound. It had a deep impact on me. It was the first time I realized that what we do as people can influence other people on a very deep level. So one day I was walking out of the hospital and I was going down the hall, and this person said, "Hey, is that a guitar you're carrying?" I said, "Yes." And he said, "Can I take a look at it?" I said, "Sure." So I took out my guitar and he picked it up and started playing it and played it very well. And I was like, "Oh, wow, you're a really good guitar player." He said, "Oh yeah, I've been playing for 30 years. And he's like, "What are you doing here?" I told him I'm volunteering at the hospital playing music for the inpatients. And he said, "Oh, you're a volunteer. Well, I'm the director of the ER here at the hospital, and if you want to volunteer in the ER, I'd be happy to have you." He's like, "Just let the director of volunteerism know that you want to shadow me." I said, "Fantastic." So in addition to playing on Sundays, on Fridays and Saturdays, I would shadow the medical director when he was in the ER. And it really sparked my interest in helping people on a whole different level. And it was my first time I found some direction with possibly what career I was going to choose. So my time in the emergency room, my time volunteering in the hospital playing music really sparked this desire to become a physician and to give back to the community on a deeper level. So it was at that point I started taking my pre-med classes, so all my basic science classes, and I started doing biomedical research. And my time doing biomedical research really opened my eyes to the depth of medicine and all the different facets that are involved. And it became more than just a unidimensional, one-dimensional subject that was in my head to this multi-dimensional universe with endless possibilities. So I decided to take all my pre-med classes. In the US, we have to take our MCATs, which is a prerequisite to applying to medical school. And I took my classes, took the MCAT, and then I applied to medical school. During the medical school application process, I was thinking in my head, this is not the path I would have ever chosen knowingly. So let me preface that by saying, in high school and growing up as first generation Indian in the United States, my parents had always drilled in me that I had to be a doctor or an engineer. Those are the only two options that I had. So in high school, I think that's why I chose music as my passion. Just somewhat rebellious, but then also is truly what I felt and what moved me. And when I applied to medical school, I had these thoughts in my head. It's like, okay, well, I think my parents' wishes and dreams are coming true. But what's really interesting about that is throughout the entire process, I was staying true to myself. I did truly find something in medicine that was calling me. I was fortunate enough to have the medical door open to me by meeting physicians who had lives outside of medicine. In my youth, I had only seen physicians as being very serious, very proper, very rigid, and I happened to meet one ER physician who was also a musician, and then another mentor of mine was one of my yoga instructors. So I was an avid yogi in college, and my yoga instructor's husband at the time, he happened to be a physician and taught at the local medical school. And that really opened my eyes to the fact that I could be a physician and also stay true to the other aspects of me that move me and define who I am. So with all this in mind, I applied to medical school, and once I got in, I was able to begin my journey towards finding my current career path. In the US, typically in medical school, the first 2 years are all our basic science classroom work, and years 3 and 4 are rotations through all the different specialties of medicine to really prepare us for whatever specialty we choose to pursue. So for me, I was selected to be part of a problem-based learning curriculum. So this program in my medical school, what we did is we broke up into small groups. So I believe it was 21 of us got selected to be in this program, where from day one, we are incorporating basic science into clinical science, and we're actually doing rotations beginning right in our first year of medical school. So I was able to learn basic science or review basic science from my pre-med training and go into depth and related to medicine, but then also related to patient care. So the first year we spent primarily in family medicine, primary care, really learning the basics and foundations of medicine. And that is our primary care specialists, the family medicine, if you will. They are truly the foundation of all medicine. And then from there, we explored all the other specialties of medicine. For me, my initial love was emergency medicine, because that was my experience in undergrad, was meeting an ER physician who was also a musician. And I kind of wanted to emulate him on some level. So beginning in my third year of medical school, we started doing our clinical rotations in the hospitals. So that included internal medicine, included subspecialties of internal medicine, nephrology, cardiology, nephrology, oncology, for example. And then we also had our surgical rotations, including anesthesia and the subspecialties of surgery and the subspecialties of anesthesiology as well. So through these rotations, for me, I was eliminating things right off the bat. My first ER rotation, as a medical student, I realized I did not want to be an emergency room physician. It just wasn't my passion. I felt like it wasn't my calling. It was a little devastating at the time. So for you going through this process, if you have one idea of who you want to be and what your choice of medicine, what your choice of specialty is in medicine, and you experience it and decide that it's not for you, it's okay. So once I decided I didn't want to be an ER physician, I did my rotation through family medicine. And we did several months of family medicine rotations. I really enjoyed it, but I didn't feel like that was the specialty I could do for the rest of my life. So, and not that you have to be committed to one specialty the rest of your life, but at that point in my life, that was my perspective. So I rotated through the hospitals, and eventually I got to my surgery rotation. And that was the first rotation where I felt like this is something I could do. So I put my heart and soul into the surgery rotation, loved it, but I was really fascinated by the people behind the curtain, by the physician behind the curtain and what they were doing, turning knobs, pushing medications, and really connecting with the patient on a different level. So once my surgery rotation was over, I decided to rotate through anesthesiology. And so my rotations were at the Cleveland Clinic in Cleveland, Ohio. And so I rotated through the anesthesiology department there. And affiliated with the anesthesiology department is also the pain medicine department. So I was really curious I was really curious about pain medicine as well, as I'd never heard of that subspecialty before until I did my anesthesia rotation. So one of the anesthesiologists I happened to be rotating with was also a pain specialist, and he's invited me to do a rotation, an elective rotation through the pain clinic. So I did this, and he was also another musician and an avid music lover. So throughout my medical journey, I was finding musicians who were also physicians, or physicians who were also musicians and also music lovers. And so it just reinforced my choice to go into medicine, and also to have the diversity of interests that I have as well. So I rotated through the pain clinic, and something happened there to me with me that was pretty profound. I found a field of medicine where there's hands-on procedures, which I really enjoy. I think that's what really drew me into surgery, was using my hands and actually practicing something physical. So in anesthesiology, same thing, starting IV lines, pushing medications, managing ventilators, all of that was really fascinating to me. But what was lacking with anesthesia was connection with people. And for me, that's what brought me into medicine, was connecting with people. And I felt pain medicine allowed me to do that. It allowed me to connect with people on a deep, intimate level, and also to perform procedures, which I love doing. And at the time, that was my direction in medicine, was really finding a procedural-based field. So I did my rotations through pain medicine and realized that this is my field that I'm going to choose. I think that as you go through this journey, it's important to explore all the different fields and be open. Some people may know right off the bat from day one exactly what they want to do. But people like me, we don't know, or we have an idea. And it changed. It changed several times along my journey until I found the field that I'm still a part of today, and my chosen specialty. You all know you're going through medical school right now. Medical school can be very trying and very challenging. You have a lot of pressure and a lot of demands, not only from everyone else, your professors, your family, but then also from within you. I mean, we chose medicine because we're driven people, and we hold ourselves to a high standard. So all that pressure can build and weigh on you. I think it's very important to find your true passions outside of medicine and use those as outlets, and think of them as energizing and ways to push you through the struggles that medical school can bring. Once I decided I wanted to be a pain management specialist, having rotated through Cleveland Clinic, I wanted the best of the best. So at the time, I chose anesthesiology as my base foundation. So I applied for the anesthesia residency at Cleveland Clinic. My goal was to eventually get into the pain fellowship at Cleveland Clinic. So I figured the best way of doing this is to do my residency at Cleveland Clinic and then do elective rotations through pain medicine in order to increase my chance of being selected as a fellow. So during anesthesia residency, once again, we rotate through all the subspecialties of anesthesiology. And at the Cleveland Clinic, we got to see some amazing, brilliant anesthesiologists, brilliant surgeons, and cutting-edge medicine that was truly mind-blowing and really intriguing. So I loved anesthesiology, but for me, it was always a stepping stone to get the pain management fellowship and to really learn pain management on a whole different level. So going through anesthesia residency, it was a lot of hours, on average 80 hours per week. A lot of time just spent at the hospital, in the operating rooms, and then outside of the hospital, sleeping mostly, and then reading whenever we could find time to do so. Throughout this entire journey through residency, I didn't play guitar as much as I would have liked. I didn't get to go to as many concerts, but I did find time to make for music, and specifically listening to music. I listened to music through residency rather religiously, if you will. And every now and again, I would find time to pick up my guitar and get together with friends and just have these outlets so I could still connect to myself. It's very easy to lose oneself when you're working 80 hours a week and you have all the demands of an institution like the Cleveland Clinic and all the pressure to succeed. It's very easy to lose yourself. And so for me, I was able to find pockets and moments of music connection. I had a great support group, family, friends. So all of these things are really critical and important to, I believe, to becoming a successful physician. So after I completed my anesthesia residency, I was able to secure my position in the pain management fellowship at Cleveland Clinic. And again, this was another grueling fellowship. We had 12 of the best pain physicians in the world as our mentors, and their expectations were very high of each and every one of us. So there was a lot of pressure to not only learn pain medicine, but during the fellowship year, we're also preparing for our anesthesia boards, so our anesthesia oral boards. So there was a lot of pressure and a lot of stress during this time. And how I dealt with it was, again, music, friends, and family. Traveling was really out of the question at the time because of the demands of fellowship. But, staying healthy was important. I was committed to my yoga practice and exercising and working out as much as I could. During the pain management fellowship, I also became interested in holistic and integrative medicine. We had an acupuncturist on staff at the Cleveland Clinic, and that opened my door to other modalities outside of what we were taught in medical school. And I found that fascinating. And I was actually able to see complex pain syndromes be treated with acupuncture. And so this really reinforced my decision to go into pain medicine because I saw the possibilities being limitless. So once I completed my fellowship in pain medicine, I began a career in private practice medicine. Once I completed my fellowship, I made a decision to go into private practice medicine rather than academia. So I took my first job in Columbus, Ohio, and worked in a very successful pain clinic with another physician. And that first year was really an extension of my fellowship. I learned so much during that year. There's a lot of responsibility on physicians, and when you step out of your fellowship training, the responsibility all lies on the individual physician. So that was a rewarding process, but also in the beginning, it was a little trying at times. But I think that the most important thing at least for me during that time, was maintaining my connection to things I truly love and also connecting with people and the patients. I would say that is that was probably the deepest thing I've learned during my first year of private practice, was the connection we had that we can have with people. And I encourage you, as you go through your journey, to remember why you're doing this. You're doing this to really for other people. Yeah, we do it for ourselves, and I'm sure there's some satisfaction and feeding our ego on a certain level, but at the end of the day, it's really about making a difference in people. I mean, we choose to go into medicine so that the people who choose not to go into medicine have people they can rely on to help them with their health and help them with illness. So that is really what I learned during my first year of private practice. After my first year of private practice in Ohio, I don't know if you've ever been to Ohio, but it's a nice state, but the weather leaves something to be desired. So I moved to sunny Phoenix, Arizona, my second year of private practice, and that is where I am today. So I spent 13 years with an anesthesia group which had a pain division, and practiced pain medicine, and really feel that I was able to make a positive influence in the community and help people to the best of my ability. Joined my second group after leaving Ohio. I thought I had found my home. My group was extraordinary, and we created, I think, one of the premier pain divisions in our local community in Phoenix, Arizona, Scottsdale. So for several years, I really felt I was exactly where I was supposed to be, and saw myself growing old with the organization that I had joined, and my life was pretty much set. At least that's what was in my head. Well, fast forward about 9 years after I joined the group, the climate of healthcare changed significantly, and in America at least, a lot of physicians and private practice groups were being taken over by private equity firms, venture capitalists, and large healthcare systems. And this was due in part to the rising overhead and costs of practicing medicine in the States. And when this happened, our group got also taken over by private equity and venture capitalists, and the whole feeling of medicine shifted for me. It became more of a job, and that isn't what I was looking for, and that wasn't why I went into medicine. We're still able to connect with people, but the way in which the practice and medicine was run was different, and I was having a hard time resonating with the new way of practicing medicine and running a business and connecting. So over the next 4 years, I was on a path to find myself again. So here I spent all this time, medical school, internship, residency, and fellowship, and then finally finding my practice in Phoenix, Arizona, and working with an extraordinary group. And then all of a sudden it changed. And now I didn't see myself growing old with this group any longer, and I wasn't sure what I was going to do. So it was at this point I started exploring other avenues. I came to a point where I realized that I'm in my early to mid 40s at this point, and I was trying to discover what I was going to do when I grow up. Everything I had planned on had shifted. And so this was devastating on some level, but also revitalizing on some level. So I started exploring some new fields of medicine, such as regenerative medicine and wellness and functional medicine. And so as I explored these other avenues, I realized that for me, the best thing I can do for myself is to start my own medical practice and practice medicine the way I want to, and truly have no ceiling or limits with how I want to practice. And once I made that decision, it was truly liberating. was incredibly scary because as medical students, I think most of us aren't taught to be entrepreneurs. We're taught that, okay, once we graduate medical school, we'll do training in a certain specialty. And once we're done with our training, we'll find a job either with a hospital or with an existing private practice group. And we'll practice medicine in our specialty. And there's our career in our life. So when I was faced with the challenges of, corporate medicine, it really forced me to reinvent myself. And they always say necessity is the mother of invention. And so I found myself as a new entrepreneur. So just in June of 2021, I had left my group that I was with for nearly 13 years and started my own practice. And that is where I am today, Integrated Spine, Pain, and Wellness. On June 1st, 2021, Integrated Spine, Pain, and Wellness in Scottsdale, Arizona was born, and I found myself an entrepreneur. So this was a place I would never have imagined I would be, and during the process of me trying to reinvent myself or discovering myself again, I was surrounded by very successful physicians and business consultants who have become dear close friends and mentors to me. And so they offered guidance, they offered their insight, their experience starting their own practices or running practices. And with all their support and my dream, I was able to do this and start my own practice. So the thing about starting my own business is in medical school, we're not taught how to start our own business, and we don't learn that in residency either, or fellowship. So, having my friends and mentors who have been able to guide me through this process has been invaluable. And starting my own practice has opened up this immense world of limitless possibilities. So although I'm still practicing my pain management skills that I learned in fellowship and throughout my private practice training, I've also begun incorporating wellness and health. And now the focus is not only shifting towards managing pain that's already there, but actually trying to prevent pain and promote health and wellness, and to really empower people to take control of their lives and control of their health. And that's one of the things that you have to realize, that as a healthcare provider, as a physician, you have the power to really influence people in a very dramatic and powerful way. And so that's been something I've mentioned earlier, but it repeats itself throughout my entire journey. And it's more apparent now, starting my own practice and being the CEO of this business and also the medical director, and then also providing direct patient care. You realize what a profound impact you can have, not only on individual patients, but the entire community. And so, one thing that I think is really important, what every medical student should know, is that you can have a path that you're on, but you're allowed to change roads and you're allowed to take detours. And you can take as many as you need until you find where you want to be. And once you find yourself where you want to be, it's okay to change it again. So that's been my journey, is change. And although at times it was very challenging and very trying, once I learned to embrace the change and realize that these roadblocks are not really roadblocks, but rather speed bumps and guideposts and signs that redirect me. It's really opened up this journey that I'm on now. At 47, I became an entrepreneur. I'm about to celebrate the 1-year anniversary of this practice, June 1st, 2022, and it's continuing to grow and evolve. And it truly is limitless on so many different levels. And that, I think, is really important. One thing I wish someone would have told me when I was going through medical school is that we truly are limitless and we have endless capabilities. And the medicine aspect is just one key and one part of it. But like I was saying earlier, once I discovered the universe of medicine, it really allowed me to be where I am now. even though at times I felt limited and forced into a certain way of practicing medicine, it's become way more apparent now that we can really do whatever we want to do, however we want to do it. I think the key is being authentic and really believing in yourself. One of the successes I feel that physicians have in treating other people is truly taking care of themselves first. In order for you to heal and treat people, you have to be in the optimal state that you can possibly be. So throughout your journey in medical school and residency, always find what feeds you and what allows you to thrive within yourself. Once you do that, you'll truly be able to help people and connect with them on a deeper and meaningful level and make a profound difference in their lives, whether it's treating cancer or, cutting out an appendix or managing their blood pressure or giving them tips on how to eat healthier and exercise. All of those things make a profound impact on people's lives. And if you yourself are living that way, it will make it a lot easier for patients to really subscribe to the treatment program you're providing. So, some final thoughts here on my journey through medicine and what every medical student should know. You should know that you've chosen a beautiful field and a beautiful career path where you have the ability to make profound positive influences and differences in people's lives. So I commend you on that. I think what is really important to know, and hopefully you've gotten from my brief talk, is that you're allowed to change. And the way you see the world today may be totally different in a few years. And if you embrace an ever-changing and evolving way of viewing the world and people, then your journey, I believe, will be smoother and it'll definitely be an easier transition into whatever mindset you're evolving into. So that's important. I also feel it's very important to be authentic and practice with integrity and believe in what you're doing and believe in how you're treating people. Anything that you offer someone, see if that is truly something that you would offer yourself. I mean, obviously evidence-based medicine drives everything we do, but there's also the component of, treating people like they were your family. And I think that is very important. And then always remember, it's okay to change and it's okay to evolve and it's okay to reinvent and redefine yourself. So thank you all for having me be a part of the first International Integrative Medical Congress. And I wish you all the success in the world. And if you look at the last slide here, you'll be able to find my contact information. Feel free to email me if you have any questions. I sincerely apologize I could not do this talk live and answer your questions in real time. I did have a prior commitment the weekend of the conference, so I will be tuning in if I'm able to. So I wish you all the best, and I'm available for questions should you have any, and I hope to see you at the second International Integrative Medical Congress. Thank you.
Hey,
Hi there.
Ashley. Can you hear me?
Hey, can you? Yes, I can.
It's
There
a
we
pleasure
go.
to have you here.
Hey, all right. Thanks for having me. There's a little bit of a glare there.
Thank you for
Let me
inspiring me
see.
with your lecture.
Okay. Yeah. Hope you enjoyed it. Let me
Yes,
see.
yes.
Sorry about the glare. Let me see. I'm in my music room right now. Let me see if I can change this around. Don't mind
Now,
all the guitars.
okay. Now they're gonna have some questions.
Great. Okay. Perfect.
Okay.
So the first question is, what skills do you think are important in addition to theoretical content for a doctor to be able to exercise his profession with excellence?
Compassion and connection. Being able to authentically connect with people. I think that patients know when physicians and providers are not being authentic and when they're just playing a role. So I think that one of the most important skills, especially in this field, because people are putting so much trust in us to take care of them, I think it's so important to be authentic and come from your heart and really remember that we're doing this for other people.
Yeah, thank you. So our next question is, what areas do you consider fundamental to be studied by doctors today that we don't have contact with in college?
Oh, that's a great question. Um, I think the most important thing, at least in the United States, would be the business aspect of it. I think that if you can learn the business side of medicine, that would allow you to open doors and ideally become more successful in whatever path that you choose. Um, that's one thing I wish I would have had before, that I didn't have going through this process. That would have made a substantial difference. That's the first thing I can think of off the top of my head.
The next question is, we who are medical students, as you mentioned before, tend to chart a path and not look at the possibilities of change around us or fear choosing parallel paths. What signs marked you so you could change your path and seek new choices?
What was the last part of the question? I'm sorry.
What marked you? What signs went through your path that made you feel like you had no choices or no path to go through?
Great. So I think that as we go through this journey in medicine, it can be very restrictive and confined because, medicine tends to be a science that can be very rigid. So I think that for me, at least when I was going through medicine, if I didn't feel that the path I was on was really truly what was moving me to practice the way I wanted to, those were the signs that I would obtain, that I would have, that would redirect me. So, like going through my medical school journey, when I did all my rotations, I thought I wanted to be an ER physician, but then when I spent 2 months in the emergency room, I didn't like it. So I was like, this isn't what I want to do. This is not how I want to practice. And then I did 3 months of internal medicine, and then I realized I don't like hospitals. So, but going through the entire process, just see what you resonate with and what you really feel, and it's okay to change. I've said many times, I think that's the most important thing, at least for my journey.
Fantastic, thank you.
So, as you mentioned, you play the guitar and also work with the pain medicine part. What could you tell us about the evidence of music therapy associated with patient treatments and change in prognosis?
Yeah, that's fascinating. I can't quote any specific studies off the top of my head, but I think that anyone who feels music knows that it can have a profound physical response in your body, emotionally, mentally. At least in Cleveland Clinic when I was training, they were doing a lot of studies on music therapy in Alzheimer's patients and people with dementia, and they would hear a song that they would connect with, and it could bring them back into the present moment. So I think there's a profound connection there. And for me, music has always been my therapy, as you can see from my guitars behind me here. So it's a small part of my collection.
So these are the questions we had so far. Thank you so much for your lecture. We hope to see you in our next edition.
Great. Thank you, Gracie. Thank you,
Thank
team.
you.
Appreciate you. Take
Thank
care.
you.
Good luck.
Thank you. Bye-bye, doctor.
Hi guys, thank you so much for being here with us this morning. I hope you enjoy it. Now there will be prize a drawing for Brazilian people only.
Pessoal, boa tarde. A gente vai fazer o sorteio agora no horário do almoço. Serão 8 sorteados e esses prêmios eles serão destinados aos participantes aqui do Brasil. Então, a gente vai fazer o primeiro sorteio agora. O primeiro número sorteado foi o número 220. A campeã foi Larissa Leite da Silva. Ela ganhou um pacote de coxinha do Mineiro Fit, um dos nossos parceiros. Vou para o segundo sorteio agora. O segundo sorteado foi o número 222. A participante é a Larissa Martins Souza. Ela ganhou 10% de desconto na loja Ela do Store. Vamos para o terceiro sorteio. O terceiro ganhador é o número 84. É o Eduardo Ambrósio. Ele ganhou um livro da Medcel. Vamos para o quarto. Foi o número 194. E a ganhadora é a Júlia Pedroso Costa. E ela ganhou um combo da Brooks. O quinto. O quinto número sorteado é o número 233 e o ganhador foi o Leonardo Machado. Ele ganhou um jaleco da Bifama. O próximo foi o número 97. Quem ganhou foi o Felipe Barbosa Brito. Ele ganhou um desconto na Academia Phoenix. O sétimo foi o número 12. Ana Carolina Andrade ganhou um Yellow Book de pediatria. E o oitavo e último foi o número 351, Rafael Bombicini, e ganhou um livro da Sanarflix. Todos esses ganhadores, eles precisam entrar em contato com a gente pelo Instagram. Nós vamos publicar no nosso story quem foi o ganhador e precisa demonstrar interesse até amanhã por volta do meio-dia. Caso essas pessoas não demonstrem interesse, a gente vai sortear novamente esses prêmios. Agora o nosso horário de almoço vai se iniciar e ele vai até às 2 horas. Às 2 horas a gente volta com a próxima palestra. Aproveitem o horário de almoço e obrigada. Pessoal, só lembrando que nós vamos trocar o link da manhã, não será o mesmo para o período da tarde. A gente já enviou no e-mail de cada participante o segundo link, nós vamos enviar agora também no chat. Aguardamos vocês em breve.